When using Uzedy 250 mg per 0.7 ml Subcut Ext Rel suspension syringe antipsychotics, it will be injected under the skin of your abdomen or upper arm by a healthcare professional. The injection site will be cleaned with rubbing alcohol before each dose is injected, and the injection should not be given into irritated, reddened, bruised, infected, or scarred skin. The site should be changed each time to lessen injury under the skin. This medication is usually given once every 1 or 2 months, depending on the brand, and it is used to switch from taking risperidone by mouth. You should not take the medication by mouth while receiving the injection under the skin. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. It is important to receive this medication regularly to get the most benefit from it. Remember to mark your calendar to keep track of when to receive the next dose, and keep receiving this medication even if you feel well. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If your condition does not get better or if it gets worse, be sure to tell your doctor. Common side effects of Uzedy 250 mg per 0.7 ml Subcut Ext Rel suspension syringe antipsychotics may include drowsiness, dizziness, lightheadedness, constipation, tiredness, drooling, weight gain, or redness/pain at the injection site. These effects may last or get worse, so it's important to inform your doctor or pharmacist promptly. Dizziness and lightheadedness can increase the risk of falling, so it's important to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, including difficulty swallowing, muscle spasms, shaking, tremor, mental/mood changes, such as anxiety, restlessness, or interrupted breathing during sleep. This medication may rarely make your blood sugar rise, which can cause or worsen diabetes. If you experience symptoms of high blood sugar such as increased thirst/urination, it's important to inform your doctor right away. If you already have diabetes, it's important to check your blood sugar regularly as directed and share the results with your doctor. Risperidone may rarely cause a condition known as tardive dyskinesia, which may be permanent in some cases. Inform your doctor right away if you develop any unusual/uncontrolled movements. This medication may also increase a certain natural substance, prolactin, made by your body, which can result in unwanted breast milk, missed/stopped periods, or difficulty becoming pregnant for females, and decreased sexual ability, inability to produce sperm, or enlarged breasts for males. If you develop any of these symptoms, it's important to tell your doctor right away. Get medical help right away if you experience very serious side effects, including severe dizziness, fainting, seizures. This medication may rarely cause a very serious condition called neuroleptic malignant syndrome, NMS. Get medical help right away if you experience symptoms such as fever, muscle stiffness/pain/tenderness/weakness, severe tiredness, severe confusion, sweating, fast/irregular heartbeat, dark urine, or signs of kidney problems, such as change in the amount of urine. Rarely, males may experience a painful or prolonged erection lasting 4 or more hours. If this occurs, it's important to stop using this drug and get medical help right away. It's important to seek medical help if you notice any symptoms of a serious allergic reaction, including fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, it's important to contact your doctor or pharmacist. Before starting to use Uzedy 250 mg per 0.7 ml Subcut Ext Rel suspension syringe antipsychotics, make sure to inform your doctor or pharmacist about any allergies you may have, especially to risperidone or paliperidone. This medication may contain inactive ingredients that can cause allergic reactions. Also, it's important to discuss your medical history with your doctor or pharmacist, especially if you have liver or kidney disease, seizures, difficulty swallowing, low white blood cell count, Parkinson's disease, dementia, eye problems, diabetes, heart disease, high cholesterol/triglyceride levels, or breathing trouble during sleep. Risperidone may affect the rhythm of your heart, causing fast or irregular heartbeat. This risk may be increased if you have certain medical conditions or are taking other drugs that can also affect your heart rhythm. It's important to inform your doctor about all the medications you are currently taking and any medical conditions you may have. This medication may also cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. Therefore, it's important to avoid driving, using machinery, or doing any activities that require alertness. It's also important to avoid alcoholic beverages and discuss the use of marijuana with your doctor. If you are planning to have surgery, including cataract or glaucoma eye surgery, make sure to inform your doctor about your use of this medication and any other products you are using. It's important to be cautious in hot weather, as this medication may make you sweat less and increase your risk of heat stroke. Make sure to drink plenty of fluids and dress lightly in hot weather, and seek medical help if you experience symptoms such as fever, mental/mood changes, headache, or dizziness. If you are an older adult, you may be more sensitive to the side effects of this medication, especially drowsiness, dizziness, lightheadedness, and QT prolongation. This can increase the risk of falling. If you are pregnant or planning to become pregnant, discuss with your doctor the benefits and risks of using this medication during pregnancy. This medication may also pass into breast milk and have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions, as they can affect how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Uzedy 250 mg per 0.7 ml Subcut Ext Rel suspension syringe antipsychotics is metoclopramide. Additionally, if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, it's important to inform your doctor or pharmacist. Be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any questions about using these products safely, consult your pharmacist. If someone has taken too much of Uzedy 250 mg per 0.7 ml Subcut Ext Rel suspension syringe and is experiencing serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe drowsiness or dizziness, fast or irregular heartbeat, unusual or uncontrolled movements, and seizures. It is important to have regular lab and medical tests, including blood sugar, weight, blood pressure, and blood cholesterol/triglyceride levels, while using Uzedy 250 mg per 0.7 ml Subcut Ext Rel suspension syringe antipsychotics, excluding select aripiprazole formulations. It is important to keep all medical and lab appointments to monitor your health while taking this medication. Be sure to take Uzedy 250 mg per 0.7 ml Subcut Ext Rel suspension syringe antipsychotics, excluding select aripiprazole formulations, as directed by your doctor. If you happen to miss a dose, speak to your doctor or pharmacist to determine the best course of action. This medication is typically administered in a hospital or clinic setting and is not intended for storage at home. It is important to follow the prescribed dosage and timing recommended by your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.